I'm Tony Surace, Director of Sports Medicine and Summit Rehab Manager for Niagara Falls Memorial Medical Center. Today I'm with Dr. Ben Levy, Orthopaedic Surgeon with UBMD Orthopaedics and Sports Medicine. Welcome, Dr. Levy.
Yeah, thanks for having me.
Sure. Today's topic for our session is we're going to be discussing sports and injury prevention. First question with you, Dr. Levy, is what are some tactics that coaches can implement to prevent injuries for their athletes?
I think that's a great question. So this is a question that we get a lot from our athletes, and being a sports medicine doctor and being an orthopedic surgeon, we really work as a giant team with our athletes. So it's not just us and the athletes, it's us, the athletic trainers, the coaches, the parents, and everybody who's part of the whole athlete team. And something that athletes can do and something that trainers and coaches and families can help with is keeping people healthy. You know, just overall health is very important, nutrition, staying in good cardiovascular shape, but also stretching and warm-ups and staying active and staying fit overall. So it's not just about practice and muscle training, but also just overall health. And you'd be surprised how important that all is.
Right.
And I know that you know that, working as a trainer for a long time.
Yeah. Great. What are some things athletes can do on their own to prevent injuries? What are some things you could suggest or recommend?
Yeah, so what the athlete does on their own is obviously extremely important also. So not just what they're doing in practice and not just what they're doing on the field, but also what they're doing on their own time. So kind of going along with that first question, the importance of what they're doing in the gym on their own, focusing on stretching, focusing on strengthening, flexibility, things like that, staying healthy, eating well. All those things are extremely important. Just good overall life, mental health, fitness, everything that goes into staying healthy is extremely important to staying on the field just as much as it is to having a healthy life.
Okay, great. Can parents play a role in helping to prevent their children getting injured in their sport?
That's a great question. So I think all parents out there know that they play an extremely important role, and you know sometimes kids aren't perfect at listening to everything their parents say, but I think that parents play an essential role in everything that goes on in their kids' lives, especially athletics. So sometimes the less fun parts of practice or training are the most important for preventing injuries, going back to some of the things we talked about already, stretching, strengthening, staying active, and all the warm-ups and eating well is not always the easiest thing, but you know all this is extremely important, and parents play a crucial role in everything that goes on.
Definitely. Okay, great. What sports or activities do you typically see that result in the most injuries? What are you seeing rates-wise?
That's a good question. I think our practice is very broad, and we see athletes of all different sports. So young athletes who play on team sports, baseball, basketball, football, hockey. Really anything. But we see a lot of people who do recreational sports or just recreational activities. So we see a lot of people who run or bike or swim, or people who just are injuring themselves in day-to-day activity, who are sore or have injuries going on. Then those are a big portion of our patients as well. So not just high-level athletes, but something that's very important to our practice is taking care of everybody in our community in the same way that we would take care of a Division I sports athlete or a professional sports athlete. And I think that's what makes our group special, is that that same exact care that goes on for a high-level Division I top of their field athlete is what we do for somebody who's a weekend warrior out playing sports on the weekend or just going for a jog, and we care for everybody the same way.
Right. That's a great point, that everyone gets the same care across the board spectrum. On injuries, what are the most common sports injuries that you see in your practice? What are you seeing coming through the door in regards to musculoskeletal things? Yeah,
so we see a really broad array. We see a little bit of everything. Knees, shoulders, hips, ankles. We really see it all. A lot of cartilage injuries, people with ligament injuries like ACL injuries, or people with shoulder injuries with dislocations, rotator cuff injuries. That changes a little bit based on the age of patients and specifically what they're doing. But we really cover the whole board. I'd say we have a very broad practice with myself and my partners. We really see the whole array of different injuries of all kinds, not just sports injuries.
Right. Okay. Great. How are the majority of sports or weekend warrior injuries treated? What type of treatments are you doing? Non-surgical, surgical, those types of things.
Yeah, that's a great point that actually you made there about non-surgical and surgical. So I'm an orthopedic surgeon, but I believe that surgery is an answer to some problems, but not every problem. So I'm a doctor first and a member of the community first, and I think a lot of people who come in with injuries or various conditions where they're sore or they have a tear or they're having a problem, the best treatment for them initially or maybe definitively is non-operative management, and that there's a whole array of options that goes into that, whether it be physical therapy or exercises or retraining in a certain way. And for a lot of people, that's a great answer. And for even more people, it's a very good place to start and an essential part of the process. And as a surgeon, we work closely with trainers and therapists and other doctors in our community and coaches and of course everybody who comes and sees us, patients themselves, as a whole team network to really get people back doing what they want to do, whether that's on the field or just going for a walk without pain. And that collaborative effort, whether it involves surgery or not, is something that I really enjoy being part of.
So that care is really like a team approach is what really comes
it's
about.
a huge team. We're really, as surgeons, we're one cog in the wheel, but we rely on everybody else as part of that team too.
Yeah, that's terrific. What is the recovery usually like for someone who becomes injured, and does it depend on age? And how long can someone be planning on being out of competition for? I guess depending on the types of injuries and things like that.
Yeah, that's a good question. That's a question we get a lot. People always want to know, when can I get back? When can I get back on the field? When can I do this? And obviously that varies significantly based on what your injury is. But going back to the last question, I want to be part of that entire process. So I'm not just there if we do surgery for surgery and then you're on your way. I'm there for that entire process. Different injuries take different amounts of time. Some take several months until you're feeling normal again. Some are quicker and we can get you back pretty quickly. But we'll be with you the whole process, and my team and everybody who works with us is excellent at being available and being part of that whole process. And that's something we take pride in, is being there for the whole process, everything that goes into before surgery, after surgery, or if there is no surgery, just getting you back until you're perfect and you're back to doing exactly what it is you want to do.
That's great. In your practice specifically, how do you work with the athlete, the school, parent, and coaches, those types of folks that are all part of that process, all together to ensure that the patient gets the best possible outcome of care?
Yeah, that's a great question also. I think for me, communication is the most important thing that we can do. So that's something that our office and everybody we work with here really prides themselves in, is open communication. So, of course, with patient's permission, speaking with trainers, coaches, physical therapists, anybody who that particular person is working with or is part of their process, their parents, their family, whoever we can, to include them and include as many people as possible so that everybody's on the same page, so we can have a real open dialogue and we can see how people are doing or what their struggles are or what their questions are, and really getting everybody on the same page and the same wavelength really is the key to success, I find.
It really helps the overall rehab process. Much, to get them back on the field.
Yeah.
Good. Myself as an athletic trainer, if I have an athlete that is injured, and I suspect a possible ACL tear or any musculoskeletal injury, what would be the best way for me to get access to you in regards to getting them seen as fast as possible? As part of the sports medicine approach, getting the athlete in, what's your best approach to be able to do that?
Yeah, so I think it's really important that people get in as soon as possible. The best way to come and see me, and I'm seeing patients at the Summit Healthplex, would be to call our office number, which is 204-3200, which is an excellent way to make an appointment with me, and we'll get you in as soon as possible, and the athlete, or if you're a parent, get your child in, or if it's for yourself, and get you in as soon as we can. We have a good availability, and we're able to get people in very quickly, so that would be the best way to do it.
Okay, terrific.